Hi, everybody. I'd like to welcome you to an introduction to the class called Listening Techniques-1. And you might hear me say LT-1 because that's how we kind of refer to it. And it's a reinforcement of the core curriculum of the visceral manipulation courses that you had an introduction to the listening skills in the core curriculum. And it's actually the development of LT-1 was because you as students asked. When we go back years in understanding our first relationships with Jean-Pierre and understanding the visceral manipulation curriculum, it was that the listening became the heart of the work. How is it that you know it's the pancreas, say, that's involved? It's not like you can tell what a range of motion is like in a shoulder joint and see visibly where a restriction might be. So he explained the listening that he does with his hands, how a restriction can show a lack of movement in between the organs and that our hands can become attracted to that. So the listening was curious. It was an incredible voyage of going into the body. And so we wanted to slow down a bit of the curriculum. And we took that little section that's in VM1, and then we took it into 3 days to help you enhance your manual skills into the visceral curriculum. Well, it's just grown so much because we take this into the orthopedic world and we go into understanding if there's a mechanical strain within the spine, we can actually do listening in the spine and determine what might be the cause of that. So it's gone into neurological evaluation, as this is a vessel of a blood supply that's going in this area that might be dysfunctional. Is it a nerve? Is it the joint? Is it the muscle? Is it the fascia around the muscle? So it became so exciting for people to have a better understanding and anatomical knowledge for our manual skills. So you as students asked at least 15 years ago, and so LT-1 has been in the growth and development for this curriculum for many years. And what it does is basically a guide for our palpation. It's a guide to give us information on the body where the restrictions tends to be more enhanced in the body. Is it causing more the primary problem in the body? So when you talk to Jean-Pierre and he does the general listening, it's trying to find the principal physical tension in the body. Now that tension, as we learn, as we go into the courses, it can be a physical strain of trauma of some kind that entered into inflammation, etc., or it can be an emotional strain. And we learn how to differentiate that as we go into the listening course and as we develop into the advanced visceral manipulation courses as well. So what is causing this physical tension, and how can we determine that with our hands? So that's what this listening evaluation is all about. So which body structures then might be involved is the next part. So general listening gets us to the where, I wonder where, which region in the body, and then what structure might be involved becomes the term local listening. So we get a section. I know you're only seeing me here, but if I got this section in the body, I'd be placing my hand more specifically to determine what is the depth and what is the direction of this attraction that might be causing a site of lack of range of motion for not only the musculoskeletal system, but perhaps for their breathing mechanism, swallowing mechanism, or digestive mechanism. That might be the esophagus that would be involved. So which structure is involved? And then we want to help you with how it is involved with the body as a whole. So if I were to say this was in the esophagus, we teach, I wonder if it's at the upper end of the esophagus or the lower end. And so we teach an extended listening off of that. The site is at behind, say, sternal level 2, and that's the local listening. It goes 70% deep, so we're at the esophagus. How does it affect the body? Then we teach a fascial load into that, and then what is the extension off of that? Where's the potential line of tension going to inside the body that has an effect of maybe the pleura? It got involved with this line of tension. So not only do they have digestion, but when they eat and it kind of gets restricted in there, they have a little bit of shortness of breath. So when you understand the anatomy and the listening takes you, you can put these concepts together. It helps you help your patient so much more with understanding and what you would do as a clinician to help that resolve. So where, what, and how the restriction affects the body is a lot of these 3 days. And we spend time on day 1 in understanding the message of your body in a general way. So when we're teaching general listening in the core, we kind of quickly go through what this might look like. And then in the listening class, we say, what if it took you into the thorax? What if it took you into the abdomen? What if it took you into the pelvic cavity? So we give you much more exploration of your palpation skills into the different sections of the body. So you understand organ anatomy more, you palpate the anatomy more. We encourage you not only with this class, but to tag team it with the dissection class. So as you feel it, and then you take the dissection class, you can see it. It just becomes more a part of your tools for hands and your library of experiences for you as a clinician. Do you identify a visceral motion to be within normal limits, or can you identify where the restriction is? And having someone who's had some experience, so the TAs and the teachers in the class, will help you understand that is a restriction. And you can feel it over and over again to bring it back in your clinical application. And understanding that in the core class, you understand, oh my gosh, there's internal environment and external environment that may have influence on the viscera to cause variances into, say, stomach. So where's the lower end of the stomach? What a Clementi book or a Netter book or theme book might say to you as to the general average of where the lower end of the stomach is. There are variances of the omentum pulling down the stomach more, scar tissue, inflammation of what might be in the pelvic organs. So we help you identify other forces in the body that can show variances in our organ systems. And we take the time in here to show you. So we have all of you students in the class, we eventually exchange people and we exchange our different feelings of variances of organs, sizes of body, fatty tissue in body, thinness of body. So it's a really great experience on palpation. So then we have to help you understand the layers. And so there's this whole section called qualities of your perception. And in the workbook itself, we share with you, if we went layer by layer, where would you be if the attraction only took you 10% deep? Or if it takes you 25% deep? What's in that anatomy layer based on the region that you're in? So we give you, it's like an individual class with the teacher and the TAs. It's like a little workshop. And we take you individually. So you have a lot of experience in the layers of the palpation to help you identify. Not only does this help you if you've had level 1 through 4 and helps you with the more detail, or if you've only had level 1 and it helps you for the continuing classes as you go meet the level 2 organs or 3 organs or level 4 into the thorax organs. So you help identify restrictions. And we also go into the hypothesis as to how your hand is possibly attracted to this restriction. We go over the laws of thermodynamics. We go over in regards to the values of water, the 4th phase of water. This is Dr. Pollack's work at University of Washington. Ron Moriarty did a lot of work with him and some research. So we're understanding when there's a restriction, the dehydration and what happens to water and inflammation and bonding. And so we share with you as to why there's an implosion and why our hands might be attracted. We want to put the science behind your understanding of that. And this is the only class that we take the time to do that in. So come and learn. And then when we go into the possibilities of your different exercises, we have you listen to the upper extremities and where the attraction may be taking you to, the lower extremities, where that attraction may be coming from the pelvic organs, but how did it affect the hip or how did it affect the knee? And the actual listening from the feet, ankle, and where that attraction could be attracting you into the body. We actually go prone in this class. You don't see that so much in the visceral core classes, but we have you go prone and we want you to listen to the mechanics of the spine. And does it take you into a facet? Does it take you into the bone structure itself? Does it take you into the cord? Does it take you anterior to the spine where it might be taking now eventually into a visceral cavity? And that's what is the primary site, causing the mechanics of the vertebrae to be dysfunctional. It's very exciting to go into the different varieties of our anatomy and systems to understand that there's a primary cause, a root cause for what might be causing that dysfunction. We do one treatment in this LT-1 class, and the LT-1 class is taking you into the treatment to understand what are my forces in the body and what the actual load is and what's an appropriate load, and the continuation of the treatment will occur, or what might be causing that load to be a little too much. Maybe the treatment doesn't proceed as into the correction. So we help you with all the listening actually through the treatment. And then the last place we go is into the cranium. And in the cranium, we'll be understanding that, wow, not only the levels of the suture and the bone itself, but the membrane system, where on the membrane system. What if the attraction happens to take us into the encephalon or the brain? What is the difference between what that feels like in our hands and when it is attracted into the brain tissue itself? So this is in preparation for going to VM5 and VM6, in preparation for the neuromeningeal courses, where that will help take you into the actual cranial nerves. Helps you for the concussion in preparation class, for the concussion, a mild traumatic brain injury, and what might be going on the cellular level with that. And then it also prepares you for Jean-Pierre's classes that he is teaching on the brain. Very exciting new information. He's spending a lot of time into the brain and has so much more information for us. So this is great preparation for you to start getting into the advanced classes. So I invite you to LT-1. I want to thank you for listening with your ears, and we're going to help enhance your listening with your hands. Enjoy.